Hello, this week's lecture will focus on conducting a literature review and developing research hypotheses. So let's start off. What is a literature review? So a literature review is both an activity and a written product. A literature review is when you conduct a review of present research and sources in order to develop a written summary that props up your research for the reader. A review of the literature is the activity of reviewing relevant literature on a research problem. So a review of the literature is a product as well. The researcher writes a report describing the existing knowledge considered relevant to the current study. Literature includes sources of knowledge that include printed products, internet sources, personal interviews, and sometimes even movies and television programs. So when little is known on a topic of interest, the researcher can look at related topics to find information. So what are the different purposes of a literature review? So one of the purposes is, again, it serves as a reservoir of knowledge for understanding previous and future research. So it helps you to understand what has already been done, what research has already been done on the topic, so that you don't have to start from scratch. You don't have to start from zero. And it also helps you conceptualize and operationalize the variables of interest. So for example, if one of your variables of interest is depression, how can you conceptualize and operationalize depression? How can you measure depression? So previous research will help you identify how depression has been measured in previous studies, and you can go from there. So for example, self-efficacy. What does self-efficacy mean for the study? How can you conceptualize it and how can you measure it? It can also help you identify potential problems in the research. So again, by going back to previous research, you can see what it has already been done and some maybe potential areas of weakness for the previous problem that it has already been done in the past. I apologize. So another purpose is to establish credibility of researcher and background work. It helps you gain understanding of findings of other researcher. So again, it is a foundation of knowledge so that you don't have to start from zero. It provides additional information to the reader. So now let's discuss what are some potential sources for a literature review. Some popular sources include professional journal articles, and these are one of the stronger sources because they normally have been blindly reviewed. They have gone through a process of reviewers reviewing those articles before they have been published in the journal article. And they also come from relevant disciplines. Some of the evaluation questions that we can do for these sources include, does the journal disseminate social work research? Are the methods clear? Is the journal reputable? Is it serious looking? Did it use primary research? Does it use technical terminology? Do the authors have credentials? Do articles have footnotes and references? Again, so these are one of the stronger sources that you can use for a literature review. You can also use internet websites. Internet websites, one of the disadvantages is that they are the most vulnerable to disinformation. And some of the questions that you should ask include, what does the URL tell you? Are the links that verify information? What are the author's credential? How is the content conveyed? Is the information there to provide information or persuade? How well is the documentation? So again, you need to really evaluate internet websites because they do have some disadvantages, some weaknesses. Books, one of the major weaknesses is that most of them do not go a review process like journal articles do. So anyone can publish a book. So you really need to question what the author's credentials are, whether the author's opinions is based on sound research, and again, whether the author is trying to pursue a specific agenda. What are the publisher's credentials? When was it written? Is there a revised edition? What do reviews say? So again, these are some questions that we need to think about. Personal interviews with authority. One of the greatest advantages is that you can get information from authorities in the field, but you really need to question what makes them an authority. You need to think about their credentials, again, similar to other sources, whether they're trying to pursue a specific agenda, whether they're trying to inform or persuade. And then you need to question their sources of where they're getting their knowledge from. Other popular sources include research reports and monograms. These can be a great source of raw data, but you really need to question who produced the data. Are these special interest groups? How sound were the methods? And some really questionable sources include content from workshops and conferences, for example, newspaper articles, radio and TV, and magazines and periodicals. It doesn't mean that you should not use them at all, but you need to really be careful because some of this content may not be backed by sound research. So that's one of the things that you need to question. Is the information provided based on sound research? Are they trying to persuade? Are they biased? So you need to think about some of those factors because these sources do not go through a peer review process. Yeah, research presentations at conferences. It can be a great place to access recent research. Again, you need to question who is putting on the presentation or conference, what are the credentials of presenters and are special interest involved. Again, you need to question their credentials and where they got the information from. Is it based on sound research? Using internet searches to locate information, it's another so especially when you're using peer review articles that are based on sound research that have been reviewed in order to be published in reputable journals. You can use search engines to find relevant literature, and some of the databases that you can use to include PsychoInfo, PsycArticles, Psychology and Behavioral Science Collection. So to use this, you can enter a phrase for a topic, and most engines will automatically search for a phrase or phrases that are relevant. So for example, any phrases that may be part of the title, abstract, or body or reference list. And you can narrow the search with information if the information retrieved is too broad. So you can keep narrowing the search so that it is closer to the topic that you are interested in. So again, these are some great databases that you can also find at through the NMSU library. So focused research questions help to reduce a research problem to a manageable size. And a good literature review helps you produce questions that would have been almost impossible to formulate prior to finding out what was already known about the problem, related questions that have been studied, and answers that have been found. So again, these doing a literature review helps you also to narrow and to focus your research questions and research problem, because you know what has already been studied before and what it has been found, so you avoid studying or duplicating research that it has already been completed before. So now let's go to the next step of writing a research hypothesis. So what is a research hypothesis? So a research hypothesis is a tentative answer to a research question. It is a prediction that the researcher has. But these hypotheses, it is important to note that they are based on previous literature. What does previous literature tells us? And it should be written in a statement form. And it should be written in a statement of the relationship between variables. And as we have already discussed before, and predominantly qualitative studies, researchers do not formulate research hypotheses prior to collecting data. So let's talk a little bit about the different types of variables. So in the textbook, the author discusses different types of variables. One of them, it's called independent and dependent variable. Dependent variable refers to the variable whose variation the researcher is most interested in understanding and explaining. So in social work research, the degree of treatment success occurs among clients is among a common dependent variable, but a dependent variable can be any variable that the researcher has declared to be the one whose variation are of primary interest. The term independent variable is applied to the variable or variables that the researcher believes may produce at least some of the variation that exists within the dependent variable. If, for example, the variable degree of treatment success among variables and a hypothesis is labeled as a dependent variable, the independent variable might be method of treatment, degree of family involvement, or frequency of treatment sessions. The term predictor variable is used in place of independent variable when the researcher has no control over or is unable to manipulate the independent variable. In this case, the term outcome variable is used in place of dependent variable, and like the dependent variable generally refers to the variance of primary interest to the researcher. These terms are used when previous research has hypothesized that the variables are either associated or correlated, discussed later in this chapter, and the values of one variable, the predictor variable, can be used to predict the values of the second variable. The terms dependent variable or outcome variable and independent variable or predictor variable are specific to a given piece of research. That is, they describe the focus of one researcher's investigation and the nature of a relationship between variables believed to exist within it. So another researcher is likely to have a different focus and suggest a different relationship. Thus, a variable may be defined as an independent or predictor variable in one research study and the dependent or outcome variable in another study. The terms confounding variable or extraneous variables refer to any variable that can mislead the researcher about the true relationship between the independent variable. So for example, you collect data on sunburns and ice cream consumption. You find that the higher the ice cream consumption is associated with a higher probability of sunburn. Does that mean that ice cream consumption causes sunburn? Here, the confounding or extraneous variable are the hot temperature caused by people who both eat more ice cream and spend more time outdoors under the sun, resulting in more sunburns. An antecedent variable is a variable that precede both the dependent and the dependent variable. I studied how so for example, in a study that looks up peer relations and perceived self-worth and how it affects a level of shyness, among a group of young adults. This an author identified two variables, temperament and parental characteristics, as antecedent variables that had an effect on all three of the variables of interest in the study. Next, an obscuring variable is a variable that interacts with dependent and independent variables in such a way as to make the two variables appear less closely related than they are really, and it hides their true relationship. So fortunately, researchers have devised ways to minimize or at least to sort out the influence of variables, potentially confounding the relationship between the dependent and dependent variables. In such cases, we no longer refer to a variable as a confounding or extraneous variables. We instead refer to it as a control variable, sometimes called a moderating variable, a potential confounding variable whose influence has been recognized and controlled. This can be done using one of the several statistical tests that employ mathematical formulas designated for this purpose. So even though there are different types of variable, we're gonna focus on the primary ones. So let's look at independent and dependent variables. The dependent variable is a variable, again, whose variation the researcher is most interested in understanding and explaining. So in this case, it could be the degree of treatment success among clients is a common dependent variable. And the independent variable is the variable that the researcher believes may produce at least some of the variation. So for example, in research, this could include the method of treatment, hours of treatment, and degree of family involvement. These are an example. So in the independent variable, it can be experimental group receives the cognitive therapy and the control group does not receive the intervention. And the dependent variable could be the score on a clinical depression scale. Another example there, group 1 receives behavioral therapy plus medication, and group 2 only receives behavior therapy alone. And dependent variable can be the score on an eating disorder scale. Here, example C, group 1 can receive individual therapy and group 2 receives group therapy. And the dependent variable could be a score on an anger management scale. So now let's take a look at the difference between dependent, independent, and predictor and outcome variables. So again, the term predictor variable is used in place of independent variable when the researcher has no control over or is unable to manipulate the independent variable. So in this case, the term outcome variable is used in place of dependent variable. So for example, does gender predict grades in a statistical score? Does education level predict job satisfaction? So these are some examples. So for example, gender is a predictor variable. Outcome variable can be a score on a statistical exam. Ethnicity can be a predictor variable. And the outcome variable can be a measure of a parenting style. Educational level can be a predictor variable, and score on job satisfaction questionnaire can be the outcome variable. And there are different types of relationships between variable. One of them is association. So certain values of one variable are found with certain values of another variable. Correlation, values of one variable covary with the values of another variable. Or causation, certain values of the independent variable cause or produce certain values of the independent variable. So these are some relationships between variables expressed in hypotheses form using association, correlation, or causation. And these are some examples. So for the association, the statement reads, among adolescent psychiatric patients, those who receive group treatment are more likely to be rehospitalized than those who receive individual treatment. For correlation, among adolescent psychiatric patients, there is a negative correlation between number of group treatment sessions attended per week and the length of time a patient remained in the hospital. In causation, adolescent psychiatric patients receiving cognitive therapy and medication was scored lower on the depression inventory than those who received medication alone. So there are different types also of hypotheses and different directionality. So directional hypothesis predicts a relationship between variables and a direction of the relationship. And a non-directional hypothesis predicts only a relationship between variables without direction. So here are some examples. So directional hypothesis reads, clients who receive individual therapy will score higher on the self-esteem inventory than clients who receive group therapy. A non-directional hypothesis says clients who receive individual therapy will score differently on the self-esteem inventory than clients who receive group therapy. And no relationship hypothesis. Clients who receive individual therapy will score the same on the self-esteem inventory as clients who receive group therapy. So consistency of conceptualization, what does it mean? So for example, the examples here says people who hold college degrees have a high level of self-awareness. Versus the second statement that says people who hold college degrees will be more likely to receive a score of 80 on the Smith and Jones scale of self-awareness than those who do not hold a college degree. So the conceptualization, it's much more clear on the second example, because the first one, it just says self-awareness. So what does self-awareness means? It means that they will score higher or 80, at least 80 on the Smith and Jones scale of self-awareness. And when you say compared to whom, so the college than those who do not hold a college degree. So let's talk about what makes a good hypothesis. So a good hypothesis, when tested, will generate knowledge that has the potential to contribute to the alleviation of the research problem. So why would a researcher ever state and test a research hypothesis that is unrelated to the problem? So let's take a look at what we need to take into consideration when writing a hypothesis. So a hypothesis, it should, you should test a hypothesis for completeness, so there's no room for confusion. So research hypothesis should be stated as completely as possible, so the person reading it should not wonder about the researcher's meaning. A sure indicator that a hypothesis is incomplete is the use of words that suggest comparison without the presence of a reference point. So for example, the research hypothesis, women under age 30 are more assertive, lacks completeness. It leaves the reader in doubt about what exactly the researcher believes to be true about the assertiveness of women under 30. Are they more assertive than women over 30, than men under 30, than all men, or than whom? A research hypothesis that would be considered more complete, for example, is women under age 30 are more assertive than women 30 and older. Specificity, so variables described should have only one meaning. So the researcher has this responsibility to ensure that a research hypothesis is stated so that no misunderstanding can result. So for example, the hypothesis, poorly timed marital counseling will reflect a low success rate, lacks specificity in addition to having other problems. So the expression poorly timed and marital counseling probably refers to that time within a couple's relationship history that they have chosen to seek marital counseling, but we cannot be sure. It may also refer to social workers' tendency to let their appointments run over time schedule or the time of the day the appointments were scheduled. So again, we need to be more specific. So another area that we need to take a look at is potential for testing. So variables must only fall within one group and some may not be able to be tested. So for example, teachers and students continue to disagree on what constitutes effective teaching or what the characteristics of good leadership are. So research hypothesis, good teachers will exhibit leadership within the classroom would be difficult one to test until we can achieve better agreement on how to measure both good teaching and leadership. Like beauty or a good personality, they remain a little too subjective to be able to measure objectively. However, another research hypothesis, teachers who post office hours are more likely to receive high teaching evaluations that those who do not post office hours is more testable. So on Canvas, you will find a worksheet in which you can practice creating a hypothesis. Please take the time to look through the worksheet and work with your team on developing a research hypothesis that follows some of the criteria that I just discussed. Your hypothesis should follow the concepts of completeness, specificity, and potential for testing. If you have any questions, please let me know. Thank you so much and have a wonderful week.